Good afternoon, I'm Alan Unell, and this series of videos is Healthcare Advocacy, where we address problems in the healthcare system, then try to take actions that make a better system for all of us. Down below in the YouTube description box, you'll find a link to the Healthcare Advocacy newsletter that is the text for today's video. You can go there, subscribe for free, get this stuff delivered to your inbox, and in the newsletter you'll find links to all of the reference material I have, all of the medical journals. When I say something has been published, you'll see a link to the scientific journal, and there's also a link to any action I have, and we have reference materials for you if you need it, how to contest a denied health claim, where to get abortion information, all kinds of good stuff. How to contact your elected representatives. Anyway, let's get started, because today we're going to talk about politics and healthcare. This is towards the end of September 2024, and Democrats in Congress have launched a legislative push to extend federal subsidies to defray the cost of health insurance for millions of Americans. The effort tees up another Affordable Care Act fight that could stretch into next year and perhaps challenge the next president. Insurance, I don't know if you've ever had to buy your own healthcare insurance, but insurance runs at least $1,000 a month or so per healthy person without subsidies. And of course, we're discussing the Affordable Care Act. Senators Jeanne Shaheen, a Democrat from New Hampshire, and Senator Tammy Baldwin, Democrat from Wisconsin, have introduced legislation to make permanent the tax credits that help lower the cost of the plans sold through the Affordable Care Act. Now, Representative Lauren Underwood, who's from Illinois, she helped write the original legislation that created expanded tax credits almost 4 years ago. She has introduced a companion legislation into the House of Representatives. Senate Majority Leader Charles Schumer and House Minority Whip Katherine Clark have joined Shaheen and Underwood at a news conference this week to unveil the legislation. It was 2 days ago, Wednesday. Anyway, the Urban Institute, which is a nonprofit organization specializing in policy research and analysis, concluded that about 4 million people could become uninsured if Congress stops funding these enhanced subsidies. And of course, there's a link to their analysis in the newsletter. These expanded subsidies will only perpetuate a never-ending cycle of rising premiums and federal bailouts, with taxpayers forced to foot the bill. The influential House Republican Study Committee wrote that in its budget proposal earlier this year. The Republican budget would end these taxpayer bailouts while they claim adopting reforms to reduce premiums and increase access to and choice of care for all Americans. This is according to the Washington Post, and I put a link in there, you can go read it. Before I go much further, let me just call bullshit on that, because the Republicans, as we know, sat for 4 years saying repeal and replace the Affordable Care Act, and they did, as we say in the engineering vernacular, jack shit. So let's take a minute to think about what the Republican community leader said. The insurance industry is squeezing the public and the government and making huge sums in profit from premiums not spent on health care, and through capitulation to their networks, that means they pay a premium for each person that's in the network, to screw the doctors and the hospitals out of a fair price for services. And then Republicans don't want to help regular low-income people with these exorbitant costs that they are allowing insurance companies to create. So what's their answer to the general public? Get sick, go broke, and die. You know, what the hell is wrong with these people? Anyway, this is just a merry-go-round of madness. It is madness. There is an answer. The answer is basic universal health care for everyone. Cover everybody. And if we do it, as a country, we will save a minimum of $400 billion every year, starting in the first year that we implemented. This is according to the Congressional Budget Office 2020 report, and there's, of course, a link to it. You can read it. Now, look, the insurance companies yell and scream every time somebody says universal health care. We'll go broke. The stock market will go to hell. The U.S. will be in bankruptcy. Again, I call bullshit. Switzerland did this and nobody went broke. What happens is the insurance companies sell different premiums with lots of optional coverage. And you know what? They did it there and they made more money than they ever did before, and they'll do it here. And they'll make more money than they ever did before. So we can have universal health care. We can save a bundle. All we have to do is let our legislators know we want it. So let's let them know in the House and the Senate, we deserve a health care system that works for all of us. There's a link in the YouTube description box if you want to call them and tell them or email them, or you can use ResistBot on your cell phone. All you have to do is on your cell phone, send this message to 50409. The message is sign, SIGN, space, PQDGDI, sign, space, PQDGDI to 50409. I'll read you the message. I'm your constituent, and I bet you are tired of the federal government adjusting subsidies for health insurance. Here's a way to save a fortune, cover everyone, and be a hero. Get universal health care passed. Our country will save $400 billion every year by eliminating overhead costs from private insurers, per the 2020 CBO report, and we can all have insurance that we can all afford. There's even a method for putting more doctors and facilities in medical deserts and rural areas so that more of us have access. What part of that don't you like? You know what? Send me a note and tell me what you don't like. Just get H.R. 3421 to a vote, the Medicare for All Act. And P.S., here's a link to the CBO report I mentioned. Let's go with facts and data, not feelings, shall we? Let's talk about the looking glass in healthcare, for those of you that remember Alice in the Looking Glass. Here's a story. It was published this week in The Hill. The Trump administration's former director of the Center for Disease Control and Prevention, the CDC, has now endorsed, just guess, Robert F. Kennedy Jr. as the right man for the job to lead the Commission on Chronic Childhood Disease. This was in an op-ed that was published this week in Newsweek. Robert Redfield said he believes Kennedy's Make America Healthy Again agenda is the right thing to do. You know what? This is just crazy. Put the anti-vax guy in charge of chronic childhood disease, which includes making sure they get a polio vaccine, a smallpox vaccine, measles, mumps, and rubella. Come on, give me a break. The guy's not a doctor, and he thinks vaccines are dangerous. I'm just at a loss for words how you think this is the right guy to deal with public health. I don't even have an action for you. I'm just beyond the pale. Let's talk about gun violence, because it is a public health issue. President Joe Biden signed an executive order this week aimed at restricting new firearm technology that makes existing weapons more dangerous. And his order will also be helping students address the trauma that's caused by active shooter drills. I really want my 5-year-old kid in an active shooter drill. White House officials said the executive order will target machine gun conversion devices, remember bump stocks, that turn regular firearms into machine guns that fire fully automatic. And they'll be restricting 3D printed guns that do not have typical serial numbers, so those things are just untraceable. White House officials said that President Biden and Vice President Harris have heard from parents and educators about the potential trauma caused by a new barrage of active shooter training in schools. How many school shootings have we had this year? Biden's executive order directs a bevy of federal agencies, including the Department of Education, Homeland Security, the Surgeon General, all prepare reports in 110 days about how to implement the drills and when and where. there's a link to the White House announcement. It's actually fairly long. It's in the newsletter. I recommend you read it because it addressed way more than gun violence. And these people, the two of them, you can tell they actually care about people because they want to limit gun deaths. Give me a break. Here's an extra credit action. You can send a note to President Biden and Vice President Harris. Thank them for the executive order restricting devices that turn guns into weapons of war. I have a link to it there in the newsletter. It's always the same link to get phone numbers or emails for those guys. Or you can use ResistBot again on your cell phone. All you have to do is send a text message to 50409 on your cell phone. Here's the message. Sign, S-I-G-N, space, PJJCMJ. Sign, space, PJJCMJ. Here's the message. President Biden and Vice President Harris, thank you for taking action to restrict weapons of war in our country. No one needs a machine gun at home, and I'm glad you're taking action. Now, let's remove the assault weapons. Thank you. That's what I've got for you today. Down below, you can like, share, subscribe to this YouTube video, subscribe to the Healthcare Advocacy newsletter, have this delivered every day in your inbox. You can also send me comments in the YouTube description box or items you'd like researched, or send them to me at healthcareadvocacy1, all one word, @gmail.com. Have a good day.